Dear Christina, dear Professor Campoy, many thanks for being with us here in Santiago de Compostela. You made a very nice presentation on ARA and DHA and brain development. Can you give the key messages?
Okay, thank you for this opportunity. I want to express that from my point of view, everybody has to know that a human milk contains both fatty acids, arachidonic and DHA, and they are present in the human milk for the whole lactation period. And there is no reason why to avoid the supplementation of infant formula with arachidonic acid. With the new regulations, there is a mandatory recommendation for DHA, but conditional for arachidonic acid. What kind of effects will have if an infant formula only contains DHA and not arachidonic acid? And even more, if this amount of DHA in the infant formula is very high and no arachidonic acid, what will be the effect? Nobody knows. We don't know what will happen. What we know it is that an equilibrium between arachidonic acid and DHA should be maintained to attain an optimal neurodevelopment. And recently we have data supporting an important effect on the brain structure and brain functionality regarding attention, for instance, or processing speed, cognitive tasks, definitely, and also behavior development. So that means that we need to supply through the infant formula for those babies who are not going to be breastfed these fatty acids, the long-chain polyunsaturated fatty acids, but both arachidonic and DHA in a good equilibrium. And another message I wanted to express is that the regulation made in Europe should be applied also in Latin American countries. In Europe, we have 32% of the population with fast polymorphism and haplotype A, and the same in Latin America. This amount of haplotype A in the population is around 97% of the population. So that means that these people, or these infants, are not able to produce enough amounts or correctly amounts of arachidonic and DHA. If we do not supply correctly both fatty acids, probably these children will have a problem. There are some studies, like the one performed by the people from ASPAC, showing that in that cases, if these babies are breastfed, you do not have problems, because it's not a problem of the breastfed infants, but not in the case of those infants fed with the infant formula. If the infant formula do not contain arachidonic or DHA, in that case you will have a loss between 4 to 12 points of intelligence quotient. So that means that these fatty acids, for the last studies demonstrating objectively that there is an impact on the brain, are very important to be maintained in the infant formula. So we need to do as much as possible to give our babies an infant formula containing both fatty acids.
Thank you for joining us at Santiago de Compostela. You just gave an excellent presentation that was of very great interest regarding the recommendation as well as the guidelines related to arachidonic and DHA, arachidonic acid and DHA. What would be your key messages, your key points from your talk?
I think there is a really gap between scientific knowledge. That means we know the content of arachidonic acid as well as DHA in breast milk, and we also know the effect of adding both of them in infant formula and follow-on formula, and current recommendation, or much better, current legislation that makes mandatory the use of DHA and only advisory the use of arachidonic acid. And we have no data on using this kind of mixture an infant formula and in follow-up formula. So we need to be careful about trying to move from ideally to current clinical use.
And what would be then your recommendation based on what you just mentioned?
I think we have to follow the things we know better. This is scientific knowledge. We know the content of both LC-PFAS in human milk. You have the model, so you only need to follow the model. And we have also experience using an amount that is probably near to the content in human milk, 0.5% of total fatty acids on arachidonic acid and 0.3% in DHA. So, and it works nicely in improving the visual as well as the cognitive development in infants. So,
good morning, Dr. Gil.
Good morning.
Thank you to join us at Santiago de Compostela. You just gave us an excellent presentation on the LC-PFAS metabolism and their importance. What would be the key messages that you would like to pass to our audience?
So thank you very much for the question. Clearly, both arachidonic acid and docosahexaenoic acid, ARA and DHA, are a key component of all cell membranes. Mm-hmm. So they are really indeed very important for the growth and development of the infant and children later on. So, but particularly from arachidonic acid as a precursor, there is a huge amount of and diversity of compounds that are produced, like eicosanoids, prostaglandin, leukotrienes, thromboxans, etc. And from DHA, there is a new line of product that the name are general docosahexaenoids. Mm-hmm. They also have an important effect in the control of the immune system, in addition to the DHA as component of membrane. Mm-hmm. In particular, both arachidonic and DHA are in high amounts in neurons and other cells of the nervous system. So they should be considered in any type of feeding. And particularly the other message is that human milk contains both arachidonic acid and DHA in particular amount worldwide, regardless of the race or regardless of the country. So, and on average, human milks provide around 0.6% of total fatty acids as arachidonic acid and 0.30% of DHA. And these are the real figures that allow and apparently in the appropriate development. And the third message, key message, is that we have learned in the very recently that fatty acid desaturases, which are involved in the conversion of parental essential fatty acid, linoleic and linoleic, into arachidonic and docosahexaenoic acid, have polymorphism, genetic polymorphism. So some particular infants are not able to produce DHA and arachidonic in relatively high amounts as needed by the growth and development. And in those particular infants, the supply of both arachidonic and DHA are clearly very important compared to other populations.
Thank you for the answer. That was very clear. What would be your recommendation at this point, based on what you just mentioned about breast milk, for infant formula and to put in infant formula for ARA and DHA?
So I think that the first recommendation is that both the parental essential fatty acid, linoleic and linolenic acid, should be in the appropriate amounts. Yeah. Because these are the fatty acids from which we get derivatives after the saturation and elongation, successive desaturation and elongation. So this clearly we need to recommend a relatively higher amount on the minimum, but we not overpass the maximum, just to avoid the inhibition by excess of substrates occurring in this type of enzyme. But secondly, the recommendation is that in addition to the parental essential fatty acid in appropriate relationships, we needed to supply both arachidonic and DHA. And one of the reasons is a teleological reason, is because a human milk contains both. But there are more scientific reasons and evidence that both are needed. Arachidonic acids are needed for the growth and development, and DHA too. And more than this, so we consider that the appropriate relationship between them provide the better fatty acid composition of cell, and indeed the corresponding functionality.